Hello dear colleagues, my name is Al-Muhammad. Today we have an acute occlusion of the right MCA in the M1 segment, which we've treated with stent retriever thrombectomy. It was 88 years old patient, male with atrial fibrillation, and he came with a severe right MCA syndrome, NIHSS score 21. The patient has got an intravenous thrombolysis with RTPA and was brought to our angio suite for mechanical thrombectomy. Onset to recanalization about 1 hour 15 minutes and needle to recanalization about 8 minutes. And as you can see in the CTA, the patient has an M1 occlusion of the right MCA, and on the CT you can see here the hyperdense media sign on the right side, and in the CT perfusion the patient had a big perfusion deficit in the MCA territory with a secondary affection of the PCA territory, without an occlusion of the PCA. And as you can see, there is a very big mismatch between the CBF and CBV. And here we have the CT on the left side before and on the right side after the intervention, and in both we don't see any hemorrhage or infarction. And here we have the diffusion after the intervention, and we can see only minimal infarctions, for example, in the right putamen, but the most of the MCA territory on the right side was rescued. And after the intervention, we don't see any hemorrhage, and the patient could be discharged without any symptoms. And here we go. We push the long sheath neuromax with the select catheter sidewinder in the aorta and configure the select catheter and pull it a little bit back, and now we are in the right common carotid artery, and we continue navigating the right common carotid artery, and now we need a roadmap to see the origin of the right internal carotid artery. And here is the origin of this artery, and we push the select catheter in the ICA, and after that we can push the neuron max inside the distal segments of the ICA. We inject a little bit contrast agent to exclude vasospasms, and now we take the aspiration catheter Seriglide 6F 125 centimeters and push it in the distal segments of the right ICA. And now we need an overview to see the occlusion, and as you can see there is an M1 occlusion of the right MCA. And now we take this 2D angiogram as a roadmap and take the microcatheter rapid transit 25 by 150 centimeters and push it with the microwire inside the aspiration catheter. We go inverted in the right MCA, and now we should be careful when we pull the microwire back in the catheter, and now we can push the microcatheter in the distal segments of the MCA without the microwire so that we don't go in small vessels. And now we take the stent retriever, it's Embotrap 3 6.5 by 45 millimeters, and we don't need to take the wall curve. We just need a straight segment of the MCA, and we are sure that we are distally of the thrombus. And we pull the stent retriever a little bit in the aspiration catheter and apply vacuum and pull the whole system back in the long sheath neuromax, and we can aspirate on the neuromax to remove possible emboli, and now we can perform a 2D angiogram and see the results. And as you can see, a complete recanalization of the MCA TK3. And we have no complications here. And that was our intervention for today. As always, if you have any questions in the comments below, contact options in the video description. Thanks for watching. That was Al-Muhammad. See you next time. Peace out.